Today, it's a monumental move. It's what we're calling our truly moving day. We're moving from a 63-year-old facility into a brand new 21st century medical center. It's a replacement facility here in Acadiana, and it's the largest building project in Lafayette's history. It's actually opening today.
Lourdes has been evaluating what to do for many years, and we've gone back and forth with the evaluation to determine whether we needed to build in place on the St. Landry campus or whether we needed to build new on a totally new greenfield site. And through all the analysis, the results came out that it would be more cost effective and better in the long run for us to move to this site and build new.
The process has been about an 18-month planning process with both Department of Health and Hospitals, Acadian Ambulance, our city parish government with the city police department. We've had tons of volunteers here at Lourdes, over 150 folks that are working on our side, plus another 100 folks working from Acadian Ambulance to get our patients from bedside here to bedside there.
Well, our ambulance company, Acadian, is helping move some 70 patients from the old Our Lady of Lourdes Hospital to the new one out here on Ambassador Caffery, something that our company's been working with the hospital officials on for the last year. And when you look at what we've been doing since 5 this morning, it's gone quite smoothly. Everybody seems to be knowing what their job is, and there's a lot of volunteers helping out. The Boy Scout Explorer Post is helping, and so local law enforcement is helping. It's gone very smoothly so far, and I think it's because there was a great deal of planning that went into it. Everybody's very positive, very upbeat, and I think that we're all going to enjoy this nice new facility here on the south side of Lafayette.
The design alone offers a lot of efficiencies for us. That's going to be great when it comes to providing care. I think that some of the technology that we've purchased, not only the advanced equipment and state-of-the-art equipment, but also some things like bedside monitoring and pneumatic tube systems that we were able to put in from the ground up, really are going to change the way we can deliver bedside care, the way that we're going to be doing electronic charting. It's just a lot of firsts for us.
We are setting a model for what healthcare can become. It really is designed with all the key stakeholder groups in healthcare in mind. It's designed for physicians, for nurses, for patients, for their families, for all of our employees and colleagues, and for other partners like Acadian Ambulance and those folks who make this great healthcare system of ours really work.
From a medical standpoint, really we offer the latest and greatest in terms of the technology, in terms of the capability. Just the floor we're on now, the procedure platform, is really a different way of treating patients. We basically, as physicians and nurses, move around the patient, and the patient moves back, and the patient doesn't move back and forth in between surgery and radiology and ER. So it really is efficiency, is safety, and is improving the quality of the medical care that we can offer our patients.
It features a lot more emphasis on clinical spaces than the old hospital did. It's about the same square footage as the old hospital, but much more, from a percentage perspective, much more of the square footage is dedicated to patient care than the old hospital was. The room sizes are 1.5 times the size of our patient rooms on St. Landry. We also have a concept here which is somewhat related to the Disney concept, front of the house, back of the house. We've been testing that out, of course, all day today, and it's worked very, very well. We've had a lot of compliments on how the separation between the public spaces and the private spaces is making this transition really easy.
It's hard to find a word to suit it. It's just a whole new experience for us. The area, the way the rooms are constructed. We can see light now. We have huge windows, beautiful grounds, all having symbolism in our faith and in our ministry.
Well, when you look at the high technology and all the new equipment they put into this hospital, they spent a lot of time planning to make sure that this is very efficiently run, something that I think is going to be very favorable to the southern part of Lafayette Parish and the whole Acadiana region. So I think it's going to be very, very good to have this more modern facility available here in our community, and our company is looking forward to working with the officials here at Our Lady of Lourdes Hospital.
We're going to be able to do a lot of firsts there, I think, in terms of technology that we're offering, from the surgical table and some of the hybrid OR suites that we're offering in the facility, as well as, like I said, the way that we're integrating our health and medical records with what's happening at the bedside are going to be, I think, some good progressive models of care for the state.
In addition to being one of the biggest economic projects that we're just completing in Southwest Louisiana, it's also, I think, a step forward in terms of what the health care is that can be delivered, and I believe that this will raise the bar in terms of what we expect out of hospitals, health care, and the medical community in this area.
When it comes to what we're providing in terms of progressive care here at our new facility, that we're going to set the standard, set some nationwide benchmarks, and then we're going to really represent Louisiana.
To see it come to completion is phenomenal from the drawings to preparing and all the furniture. It's just incredible how many people were involved.
The St. Franciscan nuns, sisters, have really worked hard for almost 100 years in the state of Louisiana, in Monroe, in Baton Rouge, and now here in Lafayette. And they're very driven by making sure that everyone has open access to care, and the care is positive, efficient, and I have a great deal of respect for what they have done in terms of their healthcare delivery, and certainly this is just another shining example of them moving forward in healthcare and in technology with this new facility.
Our ministry here in Lafayette was born out of an accident. Two clergymen were in a very, very bad accident, and they had to go to Baton Rouge to Our Lady of the Lake, which is also our ministry, and they said, let us start a plan to get a hospital in Lafayette. So in 1949, they sent a lady over and said, don't come back to Lafayette without some sisters.
It sends a message of confidence in the community. The fact that Lourdes and the Franciscan Missionaries of Our Lady Health System are willing to dedicate and devote $211 million to this community says a lot.
It's an awesome moment in our history, the Franciscan Missionaries of Our Lady, and also we are celebrating our 100th year in ministry at the end of the year, so it's just full of symbolism. 100 Days in Louisiana began out in St. Francis in Monroe, which is primarily a Baptist area, lovely people, and then came to Our Lady of the Lake. We're the last, 1949 in Lafayette, and we're about 560 sisters in the order. Only about 20-something in Louisiana.
We have an opportunity to share knowledge. We went all across this country as we designed this hospital 4 and 5 years ago, and we hope that we can share some of our lessons with our sister hospitals throughout the state. Today we have 3 representatives from a women's hospital in Baton Rouge here who are looking at how we're transitioning and how we're moving, because they're moving into their new hospital in a little less than a year.
We are not abandoning the north side or the central side of Lafayette. We have clinics on the north side. We have future plans for growth on the north side. We also are keeping our presence in central Lafayette on the current Lourdes campus with our fitness center, outpatient rehab, and some of our back-of-the-house office spaces like accounting and business office, those kinds of things. And I think this brings us to what really is being seen as the growth corridor for Lafayette and the future medical corridor for Lafayette, with Women and Children's Hospital across the street, with the Heart Hospital on the south side, surgical specialty on the south side. I mean, we're seeing a lot of growth in healthcare on the south side of Lafayette. Ambassador Caffery offering up and opening up and bringing, you know, all of Iberia, St. Martin, and the southern portions of Acadiana directly to us. It's just put us on a major thoroughfare, very visible. It's just a wonderful place to be. We're very happy to be here.
How does it feel to be in this brand new facility?
Feels good. It's beautiful.
I feel more comfortable with my mother being here. She's comfortable.
We hope that we make the difference for the patients that we're called to serve. For us, it's all about a healing ministry of Christ, and we hope that he and our patron saint, St. Francis, are pleased with what we're doing.
I just saw her face light up. She was fighting this morning. She'll cry now. She was fighting this morning with the transfer, but when she got here, she was very comfortable.
The rooms are bigger and a bigger TV, you know, and it's nice, comfortable.
We're very proud to be a newest old partner in Lafayette.
We have a tremendous high-tech facility, a Catholic healthcare facility. I don't think there's any one of its kind in Louisiana, and it's right here in Lafayette.
This is a blessing for all of us who've been involved in this. This has really been a labor of love for hundreds of people, for all our employees, for the folks who were engaged in the construction as well as the planning for the move. It's truly been the experience of a lifetime.
Thank the sisters, the FMOL sisters, and the administrative team that have had the leadership and the dedication to put us in this position. To thank all the volunteers and the nurse and the support staff that have really made today a success. The major thing that we were concerned about today was patient safety. That is always our top priority. Because of the dedication and the attention of Acadian Ambulance and our volunteers and our nursing staff, it has been a very successful day so far. We're proud of that effort, and we are proud to be able to open this facility and offer it to people of Lafayette.
We're open for business, that our emergency room is open, that will be fully operational with surgeries and procedures on the second floor and throughout the hospital. When they start going to their doctor's offices, they need to know that Lourdes is a choice. If they need to come to the hospital, we want them to choose us.